And good evening and welcome to RFL. I'm Richard French. We'll return back to the press conference if situations warrant. Now, more than 3/4 of the people in America are now being told to stay at home. That is, the coronavirus spreads and spreads fast. So tonight, you, our viewers, you're going to be a big part of this program. We did this once before. It worked really well, and I want to give you a platform to ask your questions, talk about your concerns about how your life has changed. Tonight, we have with us an emergency room doctor. We will open up the phone lines. As I said, we will take your questions and comments. The line's open. The number right there on your screen, the toll-free number 888-766-2426. Remember, you can also email us your questions to rfl@rnntv.com. We will get to that reaction shortly. But before we do, I want to bring in Andrew Whitman, our senior political correspondent, with the latest, both in the numbers and the news related to COVID-19.
And Rich, let's begin tonight with the grimmest part of this update. Official totals now put the number of coronavirus diagnoses in the United States at more than 182,000, with nearly 4,000 virus deaths across the country. Now, that last total is significant because it now exceeds the total number of lives lost in the U.S. on 9/11. And the numbers are only expected to rise. As we take a look at where the cases are happening, New York continues to be hardest hit, but we're seeing significant spikes in Detroit, Chicago, Miami, and New Orleans, along with Seattle, Los Angeles, and San Francisco, and new worries as cases begin to spike in Houston, Dallas, Philadelphia, Boston, and the DMV. So every city watching RNN tonight is now a source of concern. Globally, now past 850,000 cases and 40,000 deaths. Italy and Spain continuing to see harrowing numbers as Turkey's caseload begins to spike. One bit of financial news to share before we focus in on medical and safety gear. Goldman Sachs has now revised their estimate of the impact the virus will have this quarter on the U.S. GDP. That's a measure of the nation's entire economy. They had said it would drop 24%, which is almost unheard of. They now say GDP will drop 34% this quarter, and they predict unemployment will spike at 15%. For comparison, the GDP was plus 2% at the end of last year for the fourth quarter, and unemployment in December was 3.5%, though Goldman does see a strong rebound coming this fall. The virus now spreading so quickly and in so many places, it's led to an extraordinary plea from the captain of a U.S. nuclear-powered aircraft carrier. The San Francisco Chronicle out with a letter from the captain of the USS Theodore Roosevelt. Of the 4,000 sailors on board, the captain says 100 have tested positive. Others on the carrier think that number could be as high as 300. Sailors have been trying to keep their distance, but that's not possible in such tight quarters. So the captain wrote to the Navy asking to get the crew off the ship, calling such a move a necessary risk. He added, quote, "We are not at war. Sailors do not need to die. If we do not act now, we are failing to properly take care of our most trusted asset, our sailors." Next up, protective masks. As everyone knows, only health professionals and those diagnosed with the virus need to wear one, right? Maybe not. The CDC is now considering a change in their guidance and may suggest that every American wear one, even if it's just a do-it-yourself mask or bandana. This would contradict months of messaging. Critics point out it would not stop you from getting the virus, though it may help stop you from sharing it if you've got it. Still no official word on any change from the CDC yet. Which brings us to protective gear in general, the supply of which everyone except the president says is far lower than the need. There is something of a food fight now developing as states bid against one another, along with hospitals, municipalities, companies, and as New York Governor Andrew Cuomo described during his briefing this morning, there's a new bidder in the mix, the federal government.
It's like being on eBay with 50 other states bidding on a ventilator. And you see the bid go up because California bid, Illinois bid. That's literally what we're doing. I mean, how inefficient. And then FEMA gets involved and FEMA starts bidding. And now FEMA is bidding on top of the 50. So FEMA is driving up the price. What sense does this make?
Cuomo not the only governor to complain about that. Proof of that from a phone call between President Trump and a group of governors yesterday. CBS acquired the audio from the call. First up, you're going to hear from Montana Governor Steve Bullock describing the problems he's having just getting test kits. He's followed by President Trump with a somewhat jaw-dropping response.
We have gone time and time again to the private side of this, the private market, and where the private market is telling us is that it's the national resources that are then taking our orders apart. Basically, so we're getting our orders canceled. And that's for PPE, that's for testing supplies, that's for testing equipment. But we just don't have enough supplies to do the testing.
Tony, you can answer it if you want, but I haven't heard about testing in weeks. We've tested more now than any nation in the world. We've got these great tests, and we come out with another one tomorrow where it's, almost instantaneous testing. But I haven't heard about testing being a problem.
The president says he hasn't heard of any problems with tests seconds after a series of governors described their problems with tests. Now compare that Trump with the Trump we see every day, who assures us we have all the tests and materials we need to fight the virus. Consider that description as you listen to Trump at his briefing yesterday, describing the phone call with governors we just played for you.
We had a great call today with the governors, and I actually said, I hope that the media is listening to this call, because it was a really good call, and that was randomly selected, largely Democrats and Republicans, and they're, I think for the most part, they were saying thank you for doing a great job.
Says it was another perfect phone call, Rich.
So we're going to be talking about this from a firsthand perspective in a little bit, but we keep hearing this, Andrew. And again, you mentioned it's not just Governor Cuomo saying. You saw Montana here. I heard the governor of Kentucky saying the same thing. Obviously, governors in Illinois, we heard about this from Louisiana as well. Nationally, we have an inefficiency where we still have, unbelievably, as we're about to enter into April, our own government, instead of coalescing this and having an efficiency where there's one bidder for equipment, then applying it to the most needed areas, literally bidding against our own states here. I can't believe we're still in this mess again as we get into April.
And that's where the Defense Production Act, the president's ability to compel businesses to produce items that are of specific need, comes into play. As we've been reporting for the better part of a week and a half now, individual governors have been pressing the president to fully implement the DPA, which he has not done. Only in one example dealing with General Motors. The Times is actually out with a new report that the president has invoked the DPA thousands of times since coming into office for very specific examples, but has not done it in this case. But that's what it comes down to, Rich. It's one entity ordering all of the materials and then running the supply chain to the areas that are in greatest need, as we're hearing again and again and again. To do it any other way is not only inefficient, it stops the people who need those materials from getting them.
And again, I don't want to waste a lot of time on politics tonight here, so this will be the last part till maybe the very back end of the program. But there is a messaging that's going on that, and you've been listening to yourself, Andrew, it goes along the lines something like this. This came from Mitch McConnell's office. This came from other Republican lawmakers in both the House and the Senate today, which is, if there wasn't the impeachment, it wouldn't have taken our attention away from fighting the coronavirus. And the governors still let their people out. So don't blame the administration, blame the governors now. At the very end that I'm hearing from the Rose Garden yesterday, let's come together, there's clearly messaging that says, blame your governor and blame those Democrats here for pursuing impeachment. If we didn't, we wouldn't have the problems we're dealing with now. Did I accurately phrase that?
Yeah, but that's only part of it, Rich, because that's just one entity of blame, or one focus of blame. There's the Blame China campaign. You're now seeing governors like Ron DeSantis in Florida blaming New York for the virus and trying to block people from New York from coming in there. And so it just, there's the dealing with the epidemic, and then there's the political aspect of it. The political aspect seems to be focused entirely on the economy and on the blame game.
Unbelievable. All right, Andrew, thank you. And let's put politics in the rearview mirror for now. I want to bring in our guest, Dr. Eric Cioe-Pena. He's an emergency room physician from Northwell Health System. He's also the system's director of global health. So he's the perfect guy to get the perspective here, not just from his hospital or even his network, but on a much broader level. Doctor, thank you so much.
Thanks for having me.
The last time we were here, we got great phone calls. I know tons of people are waiting on the lines. We're going to get to those here. But some of the perspectives that you can give us from inside. When we last spoke, a week and a half ago or so, describe what's changed since then already on the ground. What's the ground truth that's going on in ERs in New York and maybe as a harbinger in ERs soon across the country?
Yeah, I think what we've seen that's changed dramatically is the just overwhelming of local resources. And by local, I mean whatever resources were in place to deal with that particular geography. So my health system has actually redistributed doctors, nurses, equipment on a day-to-day, hour-to-hour basis because we're seeing spikes in not even just New York City, but specific areas of New York City. And our volumes are going up in specific hospitals, as we've seen with some of the hospitals in Brooklyn and Queens. And the problem is that those hospitals weren't designed to take the brunt of this epidemic, so we've had to do a lot of shifting, a lot of reorganizing to make sure we're meeting that need. But it's getting challenging.
You heard what Governor Cuomo was talking about today, the inefficiencies, and I'm not dragging into the politics of all this, Doctor, but what concerns you most of the scarcities? And I'm hearing it in different ways. There's obviously the ventilators, but then there's the masks and the security, the safety gear that these first responders need, the PPE. And then also there's the people themselves. I mean, I spoke to an emergency room doctor in Italy yesterday. More than 60 doctors have died.
Yeah.
That's just doctors. Forget about that have died, let alone that have been sidelined from this. The people element, what concerns you most as we are 2 to 3 weeks, they're saying, here from the worst of it?
Yeah, I mean, unfortunately, we don't get to pick. It's all of it. I mean, we're worried about ventilator capability and capacity for our patients. We're trying to innovate in that area and come up with ways that we can use 3D printers and come up with new circuits to connect BiPAP machines and other machines that weren't designed to be ventilators to kind of bridge the gap between the ventilators arriving and the ventilator need. PPE, every healthcare worker in the United States right now is worried about protective equipment and getting sick. Being a healthcare worker seems to be a risk factor for this, to having more severe disease, and we're not really sure why that is yet. But that's one of the things we're worried about. Is we are putting ourselves at risk to take care of patients.
I want to play some sound here from different emergency rooms throughout this country, articulating some of the same concerns, and tell me if you hear this yourself.
We are using our masks indefinitely until they become contaminated or soiled.
I'm asking if you can just look anywhere, in your basement, in your attic, in your storage drawer, if you have any face masks, supplies, please consider donating them.
We need prayer, we need support, we need gowns, we need gloves, we need masks, we need more vents, we need more medical space, we need psychosocial support as well. It's not easy coming here when you know that what you're getting ready to face.
I'll get to the emotional reality. Are you hearing that? Because here's where I'm confused. Governor Cuomo, who I think has been as straight a shooter as anyone here, he says we have what we need now. He's concerned about, as we go down the line here, but he says we have what we need now when it comes to the ventilators and security. But I'm seeing doctors going on Instagram or going to asking tattoo shops, give me masks or whatever. What's the reality?
Yeah, so I think the reality is somewhere in between, and it really depends on the health system that you're working for. It depends on their ability to move things on the ground locally. It's one thing to have the masks. It's another thing to have them deployed in the ER and on the provider that needs them. And so that's...
Can you explain that?
So in other words, when a health system thinks about buying things, for instance, Northwell at the beginning of this said, we probably should buy 1 million or 2 million surgical masks.
And just to be clear for people to know,
yeah.
Northwell is a network. There's
right.
a bunch of hospitals.
Right. So it's
this
23 hospitals
right.
and 77,000 employees. And the real issue is, can we get the equipment to the hospitals that need it? And can we get the volume from that one particular hospital in Queens right now that's getting slammed, get some of those patients to other areas that aren't getting as hard hit? And that in itself is a full-time job. And there are people working around the clock to make sure that gowns and masks are getting shipped into that hospital and patients are getting shipped to other areas. And that's what kind of makes everything work.
Is it clear who's driving the decision of the best use of resources? Because I heard the governor allude at one point, well, maybe the hospitals have to work together, but you have all different networks. Yeah. Should this be done by the state? Should it be done by the feds? I also heard, and this makes sense to me, Topeka, Kansas, where they haven't been hit yet, but they only have 2 hospitals for 100,000 people with limited supplies. They're like, we can't be giving up our ventilator now because what happens when it comes here?
Yeah.
Who should decide, doctor? like what goes where?
Yeah, and I don't have a great answer for you on that, but I think that
But that's part of the problem, right?
Yeah, I mean, part of the problem is that we need a central authority at the state level, and then again a redundant one at the federal level that basically decides where these go, looks at the whole picture. You know, when we've done that from a health systems perspective, you know, we have affiliates in Brooklyn, we have affiliate hospitals that we've worked with in the past that we're asking, how are your supplies? Our CEO is on a state committee to organize healthcare resources and share. So we are looking at sharing, but it's really, I mean,
because the target keeps moving. And,
Yeah.
and I want to, and we're going to get to phone calls from people, I promise, in just a few minutes. But this comment came from a Syracuse doctor. And I want to bring it up on the screen because the title, almost as much as what he said, really struck me. As a doctor, I am a soldier in this battle and I am scared. It is completely justified to be overwhelmed. But we know that panic and chaos can never side with you when you are managing a dying patient or a pandemic for that matter. We're going to get into some of the heartbreaking stories, but are you scared? Do you see fear in people who, my God, every ER doc that I've ever met or somebody in an ICU, they deal with stress and pressure better than almost anyone because they see life and death on a regular basis. Yeah. But they admit literally fear for what they're looking at. Have you seen that in the eyes of people you work with?
Yeah, I have. I mean, fear to a certain level is healthy. We need to be we have to be fearful of this. We have to take it seriously. We have to be on guard. We're definitely, everyone's solemn too. I mean, I've described this as a war, and I think it's an apt analogy right now. We do feel like we are in battle, and you would be a fool not to be afraid of that. I think I do see hope, and I see colleagues that are volunteering for extra shifts and volunteering to be on the front lines of the hospitals. And I know that nature is there, but I think we have to make sure that they're protected when they do it.
I've said this, and I don't throw this around lightly. It is uncommon valor, the doctors and the nurses and the other folks that are there, what they are doing, and all they're asking for, frankly, is just the basic necessities without having to ask, you know, painters or tattoo parlors to give them masks. It's unconscionable.